And this is the video for tib anterior foot raises and FHL calf raises, which just stands for flexor hallucis longus for the big toe. We also use it for stabilizing, or using your stabilizer muscles, the peroneal chain on the outside when we do the calf raise. First one, and typically when we're in clinic, you know, if you've been there, we'll have you here, and if you cannot lift the back foot high enough for someone to get their finger underneath, we'll know you can't actively use that muscle properly. And then if it's passive, if you can't get your knee in front of the other ankle bone, we look at that. And then depending on how you are plantar flexing, we might do other things. And so you'll see how you should have been explained that in clinic, but there's a little brief, quick testing for what we're about to do. So, tib anterior, you're going to have back and butt against the wall. You can have head if you need the input, but you're just raising your feet up. And there's a difference between the feet and raising the toes up. If you're too weak here, you'll try to use the longer levers of the toes, but the toes shouldn't matter. You should just be able to get the feet up. And you can get farther away or near, depending on what's easier for you. The closer you are to the wall, the easier it should be. But as you're doing this, a lot of patients will hyperextend their back or try to use this instead of what they're supposed to use. So I always just say, keep everything pressed against the wall, and then up and down. Somewhere between 15 and 25 reps. Some studies say you want to get up to 100 of this plus the calf raise a day. So 4 reps, 4 rounds of 25. I typically don't ever have patients do that enough to start feeling fatigued, and I prefer throughout the day like randomized training. So if you do 10 to 15 reps a few times a day, I like 4 to 6 times a day. I like that better than trying to get up to 100. If we're dealing with tendinopathy issues, the rules change a little bit. So then we'll get into flexor hallucis longus calf raises, and a lot of these are for getting the big toe if it's not moving, if you're too tight, or plantar fasciitis. I put a ball here. It can be a toilet paper roll. You don't need a ball, but it's helpful to push against. Literally anything you can put between your legs. Elbows against the wall, and then you're going to go up and squeeze in, down, and come back to neutral. For the camera, it's up and in, down. And when I say down and out in clinic, I've learned to say down and neutral because patients will think that they're supposed to do this. All you're doing is going up and in a little bit. You should feel the outside of the leg doing work. And then down and up. And the farther you get from the wall, the more that big toe will have to stretch when you're moving it. You want to be as far away from the wall so your heels are pressed against the floor without starting in this position or coming up. So again, the calf raise should look up and squeeze, down and out. Same amount of reps through the day for that one. And those are the videos that I usually mix those two together in clinic. And so tib anterior foot raise and the FHL calf raise.